With the opioid crisis sweeping the nation, many healthcare professionals are seeing a surge in need for addiction treatment.
That's right. Well, Sunspire Health provides just that. And joining us now to talk about their detox program, we have Danielle LaPointe and Dr. Kelly Schibler.
Good morning.
Ladies.
Hi. Thanks for being here.
Thank you.
So tell us a little bit about Sunspire and the services you provide.
Well, one of the services that we provide is Detox, and we have Dr. Kelly Schibler here to talk a little bit more about what we do through our Detox program.
Dr. Schibler, detox can mean a variety of things. It can mean, detoxing, whether through your diet or for something a little bit more serious, such as addiction.
Right. Detoxing, especially from alcohol and benzodiazepines, can be deadly. And so it's very important for it to be done through a medical professional. And we offer an inpatient program so that patients can be more comfortable detoxing and withdrawing with help of medications if need be, and the psychological services.
So is this different for different people, even though they may be detoxing off of the same substance? How does that work for different people, I guess?
Yeah, it just depends on their underlying support system as well. Mm-hmm. Some of these people have really burned bridges with a lot of their friends and family, so we become a support system for them. Others already still have family support, and so we're able to just add to that.
So talk about the process. You have a potential patient that comes to Sunspire. Where do you go from there?
Okay. Well, when somebody comes through, they are initially assessed by our nursing department. That's 24 hours, 7 days a week. And the doctors will also see them. And the doctors find out what that individual needs. Not just the therapy and the behavioral modification that us therapists provide, but the medical component. There's no one-size-fits-all to treatment. There's no one-size-fits-all to detox. And I think that even though there's a science to taking somebody off of who's drinking, let's say, a liter of vodka a day, there's a science to taking them off of that. That ultimately our qualified physicians, that they work with that individual because there may be something else that's causing that detox to be, like if they had high blood pressure, for instance. Mm-hmm. And I'm kind of in your lane here, but we talk well enough to know, each other's departments, so to speak. So
this is inpatient. So how long do some of your programs last?
Some of the patients are there for 30 days. They potentially could be there even longer, but it allows them to first medically detox, which usually occurs in 7 days or less. It happens pretty quickly where they can be withdrawn from the medications, and then after that they continue to get psychiatric and psychological as well as medical care to help them to remain abstinent.
And is this for someone who recognizes that they have a problem and they are willing to themselves say, okay, I need to do this detox program? Do they call you guys, or is it more a doctor recommending them?
It's a little bit of everything.
Okay.
Sometimes if an individual has cirrhosis of the liver, then their physician may have recommended them come to us. It may be a husband, a wife, a mother, a father who said enough is enough, and gotten on the phone with one of our clinical representatives and started the process of beginning treatment. And with us, they start with detox, and we go individualized to see if 30 days is enough. Maybe they need to be outpatient for the duration of 90 days. And I don't say that to scare people away who might be considering it, but if 9 hours a week keeps somebody from going back to the active addiction, which first brought them to us, then I think people are pretty open to our recommendations and suggestions.
So for Danielle, anyone that may be watching this and thinking, I have a family member or a friend that might benefit, how can they find you guys? How can they go ahead and start this process of getting that loved one help?
Absolutely. We have 24-hour, 7-day-a-week phone services that are hosted by a clinical professional. They can call 912-712-0667 to start that process.
Great. Lots of good information.
Thanks for all you guys do.
Yeah, thank you both so much.
You bet.